vessels can be classified into blood vessels and lymph vessels. The word lymph means clear. It is another word for tissue fluid. So lymph is clear because it's tissue fluid, and blood vessels contains blood, which is made up of cells, fibers, and ground substance. Ground substance. The ground substance is liquid, and the fibers are soluble fibers. So you don't see individual fibers because they are dissolved, soluble fibers. But when there is a clot, you can see the fibrinogen and the strands. Those are the fibers which become insoluble during clot formation. So let's talk about blood vessels. Blood vessels are subdivided into macroscopically artery and vein. And microscopically arteriole, venule, capillary and sinusoids. Arteriole, venule, capillary and sinusoids. We're just talking about blood vessels and lymph vessels. And blood vessels consist of arteries, veins, macroscopically, arteriole, venule, capillary and sinusoids, microscopically. So, what is the main difference between artery and vein?
Thick wall. Artery is thick wall.
Thick wall, okay. Structurally, they are thick wall. What do they conduct?
Blood supply.
Blood from where to where?
Artery from the heart to the other parts. And
What about the artery which supplies to the heart itself?
coronary artery.
That means arteries need not supply heart to other organs. You can say arteries are those vessels which carry the blood from the lumen of the heart to different parts of the body, including the heart itself. And veins are those vessels which carry blood towards the lumen of the heart. Lumen is the cavity of the heart. Because there are coronary arteries which drain from the heart, but they open into the right atrium cavity. So it's into the lumen. What about the difference between systemic artery and pulmonary artery? Difference between systemic artery and pulmonary artery.
Systemic artery, it distributes the oxygenated blood to the entire body, and pulmonary artery takes the deoxygenated blood from the heart to the lung.
Right. And what about the thickness of the wall?
Systemic arteries are thicker.
Thicker. That means the statement is artery is thick walled is only for systemic. Because pulmonary artery are thin walled because the pressure is low in them. So the thickness of the wall is directly proportional to the pressure within the lumen of the vessels. We should use the word as you use, deoxygenated and oxygenated, instead of pure and impure blood. The purest blood is what lies in the renal vein. So all the impurities are removed by the kidney and pure blood comes. Only thing is deoxygenated. There is another, so arteries are subdivided into large size, medium size, small size. Smaller than the small size artery is arteriole. Smaller than arteriole are meta-arteriole. Meta-arteriole will either open into sinusoids or capillaries. The main difference between sinusoid and capillary is that the capillary is 8 microns in diameter. Sinusoids are around 30 microns in diameter. Sinusoids also contain macrophages in their wall. Sinusoids also contains macrophages in their wall. Also contain, both will contain endothelium, but in addition to that, sinusoids also contain macrophages. What is the size of an RBC? 7 microns. So in a capillary, only one RBC can run in a file. Whereas in sinusoid, it's a group of blood cells with 30 microns in diameter, larger in size. And from the sinusoids or capillaries, blood drains into venule, which is a small sized vein. Then a medium sized vein and a large sized vein. Large sized vein are also called as cava, C-A-V-A. So you heard of superior and inferior vena cava. The cava is a large sized vein. The structure of a blood vessel. It consists of 3 layers from inside to outside, tunica intima. So the structure of a blood vessel. So the vessel, structure of a vessel consists from inside to outside, layer tunica intima, tunica media, and tunica adventitia. Tunica intima. Tunica intima is made up of a lining epithelium which is simple squamous, and labeled as endothelium. See, endothelium is just a label. It looks like simple squamous epithelium. So we use the word epithelium, mesothelium, endothelium to different structures. But for the inner lining of blood vessel, the name is endothelium. Remember, blood vessel without exception is derived from mesoderm. All blood vessels, all layers of blood vessels. Therefore, the term endothelium, we should not say is because it's derived from endoderm. Because blood vessel without exception is derived from mesoderm only. Below the endothelium lies a subendothelial connective tissue. And deeper to that is internal elastic lamina.
Below the endothelium lies
Subendothelial connective tissue. And below the subendothelial connective tissue lies the internal elastic lamina. Under a microscope, when you are seeing a blood vessel, where the lumen is empty, the internal elastic lamina will be seen as a crumpled layer because the blood vessel is empty. But when the blood vessel stretches, when it's filled with blood, the crumpledness goes away. The crumpledness means it allows the expansion of the vessel. Internal elastic lamina is absent in embryonic vessels and fetal blood vessels. So typical example would be fetal vessels are umbilical artery, umbilical vein, stretched out. The crumpled one allows the dilatation. Umbilical artery, umbilical vein, ductus arteriosus and ductus venosus. Yes. So what are the common thing about these four arteries? Umbilical artery, umbilical vein, ductus arteriosus, ductus venosus. They are present in intrauterine life. After birth, they close. When they close, they don't reopen. So reopening of a closed vessel is because of internal elastic lamina. Absence of internal elastic lamina means once the vessel is closed, it will not ordinarily reopen. That's why the internal elastic lamina is missing in these four vessels. Because you don't want them to remain open after birth. The second layer is tunica media. Tunica media is made up of elastic fibers and smooth muscle. Tunica media consists of elastic fibers and smooth muscle. One unit of elastic fiber and smooth muscle is called a lamella. One unit of elastic fibers and smooth muscle is called as lamella. And there are many lamellae around the blood vessel. The third layer is called as tunica adventitia, which consists of connective tissue, which may or may not contain smaller vessels and nerves. Tunica adventitia, connective tissue which may or may not contain smaller vessels and nerves. The smaller vessels are called as vasa vasorum. The smaller vessels are called as vasa vasorum. Literally meaning vessel of the vessel. And the small nerves are called as nervi vasorum. The nervi vasorum are sympathetic fibers which control the smooth muscles in the tunica media. And vasa vasorum nourish the tunica media.
So, sir, even though they are parts of tunica adventitia, they will be nourishing and providing connection to the
Tunica media. Because tunica media consists muscles which require constant energy. Because it keeps on contracting to dilate and constrict the blood vessel. Similarly, nourishment is required for tunica media. Tunica intima directly gets the nourishment from the luminal blood. So now, how many lamellae are present in the tunica media? The largest blood vessel, aorta, have 70 lamellae in tunica media. 70. And this and large vessels usually contain 40 to 60 lamellae. And aorta being the largest is around 70. These lamellae have very few smooth muscle fibers. So because they contain very few smooth muscle fibers in the tunica media, their lumen will not constrict much in whatever be the circumstances. And because it is elastic, it can dilate, but it can constrict beyond a certain level because smooth muscles are very sparse. That's why large vessels are also called as elastic arteries. Medium-sized arteries have 20 to 40 lamellae in tunica media. Small-sized arteries have 7 to 20 lamellae. Arteriole and and meta-arterioles have 6 to 1 layers of lamellae. One. So with just 1 layer of lamellae makes it an arteriole. The ratio of elastic fibers to muscle fibers keeps on decreasing from large vessel to small vessel. So medium sized artery have got a probably equal mix. We said large size arteries contains largely elastic. Medium sized artery contains an equal mix of elastic and smooth muscle. And arteriole have got zero elastic fibers. Arterioles, the 6 to 1 layer, 1 to 6 layers of lamellae are only smooth muscles. Capillary have no lamellae. So there is no tunica media in a capillary. So also sinusoids. Venule contains a very thin layer of tunica media. Medium size and large size veins have also relatively thin tunica media as compared to the corresponding artery. So now we'll go into the functional classification of blood vessel. Large vessels also called as elastic arteries are called as conducting vessel. Medium sized arteries also called muscular arteries are functionally classified as distributing vessel. Arterioles, which do not contain elastic lamellae in them, that means they can't dilate. They will only either they can constrict or be of the same size. Therefore, they are called as resistance vessel. Arterioles are called as resistant vessels. The resistance which the vessel gives, if the resistance given is more, the heart has to contract with greater power to overcome the resistance. And therefore the blood pressure rises, which is called as hypertension. So the resistance vessel which is primarily responsible for the disease condition hypertension. capillaries, sinusoids, and venules. Is where exchange takes place between blood vessel and tissue fluid. Therefore, these are called as exchange vessels. Most of the exchanges occur in capillaries. Sinusoids have an additional function of eating up dead debris. In the blood, the macrophages eat up the dead particulate matters. Venules are the region where cellular exchange takes place. So when white blood cell wants to leave or enter the blood vessel, they do so at venular level rather than at capillary level. So capillary level exchange is mostly of nutrients and waste matters, but the WBCs leave or enter blood vessels at venular level. Out of the 6 liters of blood that we have in a 60 kg person, 5 liters for a 50 kg person, 70% of the blood lie in the veins. 30% only lies in all the other vessels. So medium size and large size veins are called as capacitance vessel. Medium and large size veins, because they store 70% of the circulating blood, are called as capacitance vessel. So you have 5 types of vessels: conducting vessel, distributing vessel, resistance vessel, exchange vessel, and capacitance vessel. Is it clear? There are 2 words when it comes to blood vessels. One is called as arteriosclerosis and atherosclerosis. Arteriosclerosis and atherosclerosis. Arteriosclerosis, the word sclera means hard. The elastic fibers in tunica media are replaced by collagen fibers. The elastic fibers in tunica media are replaced by collagen fibers. Not all of them, but most of them, many of them. So the collagen fibers are inelastic. So the artery literally becomes hard. So if it is not stretching, the load of the heart increases. So hypertension is systolic and diastolic, when the heart contracts and when the heart relaxes. The resistance vessel increases diastolic blood pressure. The arteriosclerosis increases systolic blood pressure. Whereas atherosclerosis is where there is a fat deposition in the tunica intima. This fat deposition are called in the tunica intima. The fat deposition is called as atheromatous plaques. and deposition are called as atheromatous plaques. And these plaques are responsible for reducing the lumen, damaging the endothelium, exposing the subendothelial connective tissue to blood, the moment the subendothelial connective tissue is exposed to blood, there will be formation of blood clot there. Blood clot is called a thrombus. This clot can get detached from that area where it formed and it will become mobile in the blood. A mobile clot in the blood is called as embolus. So the clot is called a thrombus. When it gets dislodged from the clot and becomes a mobile structure, it is called embolus. EMBOLUS. So usually thrombus and embolus go together. The phenomenon is called as thromboembolism. The embolus is small enough to travel through the vessel, but too large to maneuver through capillaries. So it goes and blocks the capillaries. Thromboembolism. The phenomenon of thrombus and embolism is called as thromboembolism. Embolus is small enough to travel through arteries, but too large to pass through capillaries and it gets blocked.
So then there is something called as emboliform.
Emboliform is the mobile embolus.
Okay.
Anything which is round shaped is emboliform. So there is a round shaped cerebellar nucleus which is called as emboliform nucleus. When there is a atheromatous plaque and the lumen of the blood vessel is reduced, there are two ways we can overcome that. You put in a stretchable wire there in the form of a network. The word is stent. And thereby the stent can be distended and keep the lumen large enough. This repair of blood vessel is called as angioplasty. So in the region of atheromatous plaques, you can put in a stretchable network of wire called a stent. The procedure is angioplasty. This can occur in all blood vessels. But when it comes to heart, there is another alternative to angioplasty, and that is called as CABG, coronary artery bypass graft. So there what you do is connect a new vessel from somewhere else in the body, connect it to the aorta, one end, the other end you do connect it to the artery, coronary artery, beyond the block. So So you have to make an opening in the aorta, you have to make an opening in the vessel beyond the block and connect it. So you have bypassed the block. Before you do the bypass, you should know where the block is. For that, you introduce a radio opaque dye in the coronary artery and take an X-ray. The procedure is called as angiography. So angiography followed by either angioplasty or coronary artery bypass graft.
So what happens in case of arteritis?
Arteritis is common term for atherosclerosis and arteriosclerosis. Inflammation of arteries. We did mention in the beginning, artery in Latin is called as arteria. Which comes from the Greek word arteria. Arteria, which literally means air carrier. AIR, air carrier. Because after death, the arteries are empty. Seems to be filled with air. Veins show the clot. Seems to be filled with blood. Nerves don't show either of these two. So it was believed long time back that air from the lungs goes to the tissues through arteries. Blood from the heart goes to the tissues through veins. Vital spirit from the brain goes through the hollow nerves to the tissues. So every organ needs air, every organ needs blood, every organ needs vital spirit for it to function. So nerves are solid, but they felt probably after death it has become solid. While it was alive, it might have been having a lumen through which the vital spirit travels. And it's the solidness which is why the person died. Because why now vital spirit is not going to the tissue. And artery contains air. So, and the air goes and comes back like waves. So also the blood, so also the vital spirit. Vein is called as vena in Latin. And phlebo in Greek, Phlebo. That O is of course the connecting letter. So when artery is inflamed, you have to use the Greek word artery and add itis to it. So it becomes arteritis. So arteria, arter is both Latin and Greek. Whereas when veins are inflamed, it's called as phlebitis. And when there is a disease formation in the vein, it's called as phlebosis. Remember, superficial vessels, veins, are chosen when you want to draw venous blood or if you want to inject intravenously. When you put in a needle, tunica intima has been breached. Some endothelial connective tissue comes in and clot will form there after you have withdrawn the needle. And that site can often get infected. So then that condition is called as thrombophlebitis. Thrombophlebitis. deeper veins are surrounded by muscles. So when the muscles contract and relax, it squeezes the deeper veins to pump the blood back to the heart. This is called as peripheral heart. Deeper veins are surrounded by muscles. When the muscles contract and relax, they will pump the blood back to the heart. And they will pump the blood back to the heart only because there are valves in the veins. So they do not allow backflow. If, however, your muscles don't contract for a long time, like you are sitting in a economy seat of a long flight, 8-10 hours, and you don't get up from that seat at all. So the muscles are relaxed. Or if you are lying supine in a hospital bed for many days, the muscles don't contract. If the muscles don't contract, blood stagnates in the veins. Stagnated blood can become a clot. This condition, of course, is non-infective because the clot formation without any source of infection entering is called as phlebothrombosis. So notice the word superficial veins thrombophlebitis, deeper veins phlebothrombosis. The valves in the veins are just adequate size to prevent backflow of blood in a normal vein. Valves in the veins are just adequate size to prevent backflow of blood in a normal vein. But when the vein is distended, the valves fail because the valves don't touch each other. And there's a gap between the two flaps of the valves. So the backflow of blood will occur. When the blood backflows, the vein distends further. The valve further becomes non-functional and allows further backflow. The veins becomes dilated. It also gets elongated. That will also increase the volume. Elongation, dilatation. But the limb size is the same. So you've got a longer vein and a dilated vein to be accommodated in the same size of the limbs. The vein automatically becomes tortuous. So 3 criteria: elongation, dilatation and tortuosity of superficial veins of lower limb. Are called as varicose veins. Elongation, dilatation, tortuosity of superficial veins of the lower limb are called as varicose veins. Remember the key words here: superficial veins. Deep veins do not undergo varicosities because there are muscles surrounding them which will not allow the blood vessels to dilate, distend further. Plus, even if they are distended, you have no idea that they are distending. Of lower limb, because lower limb the blood has to flow against gravity to the heart. In upper limb, they have to flow against gravity for a short distance. And most of the times the upper limb is not in anatomical position, but in functional position. So the ascent is even lesser. So usually you don't get varicosities of the upper limb. If you see traffic policemen, they have to stand at that side for a long time. So their socks are not like our socks. Their socks are wrap around their legs like a elastic crib bandage. So that keeps the veins compressed. Do not allow backflow of blood. Do not allow flow of blood to the superficial veins. Veins have to pass through the deep veins. Blood has to pass from the lower limb through deep veins, which are not being compressed. So superficial veins are not allowed to become dilated because they have to stand at one place for a long time. Then backflow would have occurred. Luckily, that bandage prevents the backflow. So that's about some disease condition of arteries, veins, right? Now let's talk about the pressures of blood in the blood vessels. In the large arteries, so also the medium-sized arteries, the pressure when the heart contracts, cardiac systole, is on an average 120 millimeters of mercury. And during cardiac diastole, when the heart relaxes, is on an average 80 millimeters of mercury. That's why we call the blood pressure as 120 by 80. It's not 120 upon 80, it's 120 and 80. And if at all you subtract the two, 120 minus 80, that is 40, is called as perfusion pressure. Have you used the word average? So it need not be exactly 120 by 80, that is normal. Lesser than that, more than that, together makes the average. So if you have got 130 systolic, that's perfectly alright. 140 is something to be concerned about. Beyond 140 is defined as hypertension. Actually, systolic pressure is not all that important to the heart. As age advances, systolic pressure also rises. So if your systolic pressure is 100 plus your age, okay. So 60-year-old can have 160, no problem. Diastolic pressure is the load of the heart. Even when the heart relaxes, there is so much of pressure in the blood. It is the load of the heart. Diastolic pressure up to 90 is okay. More than 90 is defined as hypertension. When should a person be treated for hypertension? Is when the person is hypertensive. And the definition of hypertension is given by pharmaceutical companies. Earlier, 140/90 was considered normal. And no need for antihypertensive medication. Now these people realize that a lot of people become non-hypertensive by this definition. So they reduce. 90 means you require treatment. 140 above you require treatment. Either of the two changes you require treatment. So the people with 160, 85, 60-year-old person, 160, 85 is normal. And crossed 140. Diabetes. You require treatment, you require medication. There are individuals whom I know had 170 by 110. For many, many years, did not take any hypertensive medication and lived up to a ripe old age of 80. So the term hypertension should be taken with a pinch of salt. And further rise of blood pressure, that apart. This is at the arteries. At arteriole, the pulsing blood pressure gets dampened. And by the time it reaches the arteriolar end of capillaries, it has reduced to 30. And this is irrespective of the phase of heart contraction or relaxation. That means that 120/80, which was fluctuating between heartbeat, has now become uniform. That means the pulse difference has vanished. That's called dampening. And the dampening is, it has reached the arterial end of capillaries at pressure 30. Blood contains plasma, and the plasma proteins have got a osmotic pressure. The osmotic pressure of plasma proteins is 25 millimeters of mercury. So the 30 millimeters of mercury is the outward pressure on the capillaries at the arteriolar end, and 25 is the inward pull of fluid from the tissues into the blood. So net result, there is still 5 pressure exceeding for the outward push. So the arterial end of capillaries, 30 is for outward push, 25 is for inward pull. Net result +5 towards outside. So fluid leaves the capillaries at the arteriolar end. Along with fluids, oxygen, glucose also leaves. That means the nutrients also leave. At the venous end of capillaries, the plasma proteins inward pull of 25 remains 25, because plasma proteins have not left the blood. But the inner pressure has reduced to as low as 8. Net result, the fluid are taken back in at the venous end of capillaries. Osmotic pressure of plasma protein pulling the fluids inside remains 25, because plasma proteins have never left the plasma. Only nutrients have gone. but the outward force is now reduced to as low as 8. Net result is fluid start entering the blood vessel in the venous and capillaries. Along with that, the waste products and carbon dioxide also enter the blood. Waste products can be lactic acid. This is the classical waste product which is seen when the muscles undergo anaerobic metabolism. In aerobic metabolism, this is carbon dioxide, end product of glucose breakdown. So these are taken back in at the venous and capillaries. It has been found that the amount of fluid leaving the arterial end is greater than the amount of fluid re-entering at the venous end. How much greater? Around 1 ml per minute more. Every minute, some fluid leaves the arteries and lesser fluid re-enters the artery. 1 ml is left behind every minute. The total amount of blood is only 5 to 6 liters. If that 1 ml keeps on getting lost, very soon you have no fluid left in the. So for that, parallel to veins, another channel needs to be opened up. This channel is closed towards the tissues, but open towards some other parts of the veins. Because the amount of fluid leaving the blood vessel is greater than the amount of fluid returning back to the blood vessel, this fluid has to be taken back to the blood. So a parallel channel opens up. This channel is closed at tissue level. When you say close the tissue level, then what is the purpose? It's a valve. It allows tissue fluid to enter that vessel, but does not allow that vessel fluid to re-enter the tissues. So close means valve-like closure, allowing tissue fluids to enter that vessel. But that vessel will not, the contents of the vessel will not enter the tissue fluid. Of course, what it contains within that vessel is only tissue fluid, which is called as lymph. This vessel is called as lymphatics. Smaller lymphatics are called as lymph capillaries. Medium-sized lymphatics are called as lymph vessels. Larger-sized lymphatics are called as lymphatic ducts. Smaller sized lymphatics are called as lymph capillaries. Medium sized lymphatics are called as lymph vessel. Larger sized lymphatics are called as lymphatic ducts. These lymphatic ducts open into veins. Where the venous pressure is very low. inferior vena cava, because it's carrying blood from lower limb, is always under higher pressure. So rarely do lymphatics open into inferior vena cava. But they can. It's not mandatory. But usually they don't. Superior vena cava, because it carries blood from lesser areas, and most of the times it's pro-gravity. The pressure in the superior vena cava is extremely low. Can be as low as -5 to +5 millimeters of mercury. In physics we had learned pressure is a scalar quantity. If pressure is a scalar quantity, there cannot be negative pressure. And you just now said that the superior vena cava may have pressure -5 to +5. -5 to +5 with respect to atmospheric pressure. So all the pressure that we use, millimeters of mercury, they are all with respect to atmospheric pressure. So at 120 by 80 millimeters of mercury, 120 millimeters above atmospheric pressure, which is around 760 millimeters of mercury. 760 plus 120. 760 plus 80. 760 plus 30. 750 plus 8 plus 5 minus 5. Negative pressure would mean if that vessel remains open, air can enter that vessel. What will happen if air enters the blood vessel? Air embolism. So what? What will air do?
Break the blood flow.
How will it break the blood? Air is less resistant than blood itself. No? So how does air break the blood flow? What is the main difference between air and liquid?
Molecular composition and
Liquids are incompressible, air is compressible. So if large amount of air enters, say something like 200 ml of air enters the neck veins, say, that will enter, it will not impede the blood flow towards larger vessels. It will flow through. It will reach the right atrium. Then from right atrium it will go to right ventricle. And from right ventricle it will go into pulmonary arteries. When it reaches the pulmonary capillaries and there is a resistance there, and the push from the blood comes from behind, the air will compress. And when the heart relaxes, air will expand. Heart contracts again, air will compress. It's not flowing. A fluid, when it's getting pushed from behind, because it can't compress, it moves ahead. Air, because of the ability to compress, does not move ahead. That causes air embolism, which affects the lungs. Pulmonary embolism. Clot also causes embolism in the lungs only, from the peripheral vessels, because they are lying in the peripheral vessels, they will enter the right atrium, right ventricle, pulmonary embolism. This is air embolism. That's why if you notice, in movies or otherwise also, you must have seen nurses remove the air from the injection. Even little fluid also comes out. Then only they inject. Because you do not want to inject air into the body. But as you said, to kill, It requires some 200 ml of air, not that minuscule amount of air. That will not, such minuscule amount of air will get absorbed by the blood. So you don't have to bother about such things, but still, just to be on the safer side, just to feel satisfaction that you have not injected air. In addition, you never know that air within the syringe may not be sterile. You push the sterile fluid out, pushing the air out. So now whatever is there is a sterile injection material only. Okay? But how can 200 ml air enter? If you have got a cut in the neck and it doesn't bleed, that is bad. If it doesn't bleed, means air can enter. And you never realize that there is a cut. Air keeps on entering. You can have an accumulation of 200 ml. So if you get a cut, especially by kite ropes, they are very sharp edged. They can cut through your neck, cause a bruise, but not bleed. If you lie down, then it will bleed, because you are under pressure of the heart. If you remain erect, that is negative pressure. It will not bleed. So to confirm that what you have got a bruise in the neck, whether it's actual cut or not, if it is bleeding, it is good. You can stop it from bleeding. If it is not bleeding, you will not realize. It's a vessel which is cut and air is entering through it. Now, out of all these things, so many vessels we have discussed, lymphatic vessels which can be visualized with the naked eye are only the largest ones, lymphatic ducts. You can see large size, medium size and small sized arteries and veins. You cannot see arteriole, capillary, sinusoid venule. They have to be observed under a microscope only. Okay? The vasa vasorum also has to be looked through a microscope only, because they are small blood vessels like the tunica adventitia or larger vessels. What is the main difference between medium-sized artery and small-sized artery? Layer-wise, we already mentioned. Medium-sized arteries are most of the named arteries. Small-sized arteries don't have names. So named blood vessels can be either large size, like we have named the aorta, or it can be medium size, like radial artery, ulnar artery, etc. The artery entering and supplying the brain are elastic throughout its length. Starting from aorta, those blood vessels which supply the brain are elastic, so that when there is stress, threat, sympathetic nervous system activates and causes constriction of the blood vessels. But at that time, you cannot allow compromise of blood vessel to the brain. So the brain vessels are not compromised because they are largely elastic. They hardly have any muscle fibers in its wall. But then, if there is no elastic in between, if there is no muscular artery in between, What about the dampening effect? Dampening effect was done by the arteries which have muscle in their wall. There is no dampening effect. Luckily, before it supplies the brain, it takes a lot of twists and turns. And the last twist which the internal carotid artery takes is even given a name, carotid siphon. By these multiple twists and turns, including the carotid siphon, that dampens the blood flow without muscles coming into the wall. And then it directly supplies. Once it is dampened, there is equitable distribution of artery to the brain, irrespective of the phase of the heart. Otherwise, it will get in impulses. Rarely at a time, that carotid artery before the siphon, it ruptures. If it has ruptured before the siphon, there is pulsations. It ruptures into a structure called cavernous sinus, which also drains blood from the eye. The artery is ruptured within the cavernous sinus, the eyes will pulsate and bulge out exactly at heart rate. It's called as pulsating exophthalmos. Internal carotid artery supplying the brain. Ruptured before the siphon, carotid siphon. Within the cavernous sinus. This cavernous sinus drains into it ophthalmic veins. And because the pressure is not dampened, the eyeballs will pulsate and bulge out exactly at heart rate. Every time the heart contracts, the eye will bulge out. Heart relaxes, the eye goes back in. Pulsating exophthalmos. This rupture of carotid into cavernous sinus is called as keratico-cavernous fistula. If you got an enclosed pathological structure within the body, lined internally by epithelium and containing a fluid within it, blind sac, it is called a cyst. An enclosed structure, blind, lined by epithelium, containing a fluid within it, is called a cyst. Enclosed structure, but one opening is there. Lined by epithelium, containing fluid, is called a sinus. An enclosed structure lined by epithelium containing fluid but open at two ends is called a fistula. So that's why carotico-cavernous fistula. This is open at carotid end and cavernous end. So fistulous communication. The sinusoid, term which we had used for one of the exchange vessels, also is something like a sinus. But it's not a pathological structure. So it's called sinusoid. Dural vessels, dural veins, do not contain tunica media. Dural veins do not contain tunica media. But they are open at both the ends and they are not pathological. They are called sinuses. Okay? Dural venous sinus. So you should understand that it is neither venous, it's neither sinus or it's open at both the ends. So it's more like a fistula, but it's not pathological also. Because of lack of words. We can't think of any other words, so it is called a sinus. Shall we stop here? So what have we discussed today? Blood vessels and lymph vessels. The lateral pterygoid muscle, which helps in opening the mouth widely, contains blood vessels within them. So, when there is stagnant blood in the lateral pterygoid, you take a yawn. Yawning is contagious only to those in whom the blood is likewise stagnated. Compare this with the reflex contraction of a full urinary bladder at the sound of running water. So you must have seen mothers training their children to pass urine. Sound of running water. An empty bladder will not contract even by the sound of Niagara Falls. This can be confirmed. A third peripheral heart. We spoke about calf, lateral pterygoid. A third peripheral heart lies in the back of the neck. Back of the neck, there is a bulging muscle. So if you've seen people who have exercised a lot, especially the neck exercise, on the back side, there will be two bulges with a depression in the center. The two bulges are produced by two bulky muscles called as semispinalis capitis. Semispinalis capitis also contains venous blood within them. When you isometrically contract semispinalis capitis, what is isometric contraction? Muscle attempts to shorten but does not shorten, does not alter its length. That's what isometric. When you isometrically contract the semispinalis capitis, the stagnant blood does not move. Whereas when you actually shorten the muscle, shorten its length, there is diameter thickens, that squeezes the blood. So you must have seen people in the examination, they are furiously writing. The neck is fixed, stagnant. Intermittently, they extend the neck, then start writing again. By extending the neck, isotonic contraction of the muscle bulges, the blood vessels are squeezed, and the blood comes back to circulation. So in the examination, seeking divine inspiration is permitted. But remember, the two diagonal muscles in the side of the neck, sternocleidomastoid, they do not contain blood vessels within them. So trying to say, I am improving my blood circulation by looking here and there, that is not permitted. Divine inspiration is okay.